Good? So, ladies and gentlemen, good afternoon. I hope it's a nice Monday. 1 hour ago, I was outside. There was a sunshine, which is very, very good in Brussels. I just arrived. Hey, good to see you. I just arrived from Budapest to be your host. But first of all, I would like to apologize because normally I'm always there from the beginning till the end of all the meetings because all of them are some kinds of study tour, meeting for me to have more and more informations. But no, I will have an ambassador meeting outside. So immediately after my short speech, I will go out and I will go back. It will be a very short meeting, but we couldn't organize, we couldn't ask any other slot. So Milka, can I start?
Please.
So I'm István Ujhelyi, MEP from Hungary. I'm member of the MV committee and also the subcommittee, the new subcommittee. And the last 4 years, I tried to be very good student for the health issues. I'm not a professional. My parents are doctors, but it's not enough to have all the knowledges. But some years ago, I made a decision to try to serve the public health issues. I'm very active at home in Hungary. I'm from the opposition, you have to know that. So not part of the regime, but I was member of the government before that. And I worked together with NGOs. I'm also very active and try to be host and partners to all the NGOs here in the European bubble. So thank you so much, and thanks a lot to Dr. Milka Sokolović, my good friend from the European Public Health Alliance, and also a huge thanks to the EU4Health Civil Society Alliance. In numerous European member states, including European and Eastern European countries, distressing trends have emerged, such as shrinking space for the civil society organizations, limited civil dialogue, and even restrictions on their activities. Some face attacks, smear campaigns, and prevention from fulfilling their monitoring role. As I mentioned, I'm Hungarian, and as Hungarian, I can say that this issue is even closer to me, as the Hungarian civil organizations have been fighting for funding and for being able to do their work properly for quite a long time now. They try to be independent, and the regime doesn't understand what does it mean to have civil organizations. They are not part of the state government policy. They are part of the society and part of the big structures. I remember when I was state secretary at home, I always asked my colleagues to organize for me meetings with the NGOs. Sometimes they couldn't be on the same side. I had to make decisions. And for example, the budget issues are very complicated issues. Somebody has to make decisions. But I really wanted to understand all the different partners. So I think when we are talking about the future of the European democracy, then we have to realize that we have more and more member states where we don't have free possibilities for the NGOs and the civil society organizations. These worrisome developments were even highlighted in the EU Commission role of law report, the rule of law report in 2022. And we are waiting for the new report, which will arrive next week or in 2 weeks. I think we will not have a smile when we will read it, because there are more and more member states where we have problems. Access to secure, sustainable, stable, and long-term funding opportunities has become a battle for all NGOs, irrespective of their scale of operation. The availability of sustainable funding varies greatly among them, and the challenges they face, I know very well. Notably, health NGOs have been particularly affected despite the increased emphasis on strengthening health policies brought about by the COVID-19 pandemic. In 2021, health CSOs faced the threat of losing public funding through operating grants, which are critical to supporting their operations. Thankfully, through a massive, well-coordinated advocacy campaign supported by over 50 members of the European Parliament, several member states, and the media in Brussels, the operating grants were reinstated. However, the multi-annual financial frameworks, the MFF, were never reintroduced, leaving health civil society on unstable grounds. The uncertainty surrounding operating grants has stayed, with the Commission re-emphasizing the phased-out nature of this funding. So addressing this position, recognition, and support of the CSOs is of central importance for the European Union if we are to ensure the thriving of European democracy. The EU would need to take concrete actions to implement the recommendations that emerged from the Conference of the Future of Europe in 2022. And these recommendations expressed strong support for the NGOs, the civil society organizations, and called for their enhanced role, engagement, and the strengthening of civil dialogue and the civics space. Furthermore, the development of a civil society strategy is essential to provide the EU with the means to bolster civil dialogue and civic space, protect civil society organizations, and enable them to fulfill their vital role. We must also recognize the relevance of the ongoing development of the defense of democracy package at the EU level. As I already mentioned at the beginning, the civil society organizations play a significant role at the EU, national and local levels. And I would like to mention that because of the war, the Russian invasion of Ukraine, also the COVID-19, we have to rethink our partnership relations with the civil societies and organizations. I remember very well 9 years ago when I arrived to Brussels, it wasn't the same. Every week I could meet one or two civil NGOs, civil organizations. There were lots of lobbyists, of course, because somebody paid for them. The big companies have budget to finance the lobby organizations. But maybe because of the health issues, the last years, every week I have 4, 5, 6 kinds of meetings with NGOs, with civil organizations. It means there are more and more. But the question is, who will finance it? Because directly, the European citizens are not able to do it. It is too far for them to finance somebody or something in Brussels. I don't want to pay it, and they can't. Technically, it's very difficult. But somebody has to finance it. And now we will have more, if we are talking about the health issues, we will have more and more important dossiers and files here in the European Parliament and also in the Commission or the Council on the table. And we need the civil organizations' voice and interest. Not only the patient organizations, they are here, they are part of it, but there are more interests. So that's why I wanted to be your host, and thank you so much Milka, to invite me to be the host. And I promise you, Zoltán will stay together with you. Zoltán is much clever and smarter than me. I'm only a politician. He's working 24 hours together with you. And I try to be back soon. I have to go to the embassy, and after that I will be here again. Is it okay? Thank you so much, and I'm so sorry. It's not my style, believe me. But I'm coming back. Zoltán, you will sit here. I have a chocolate to the ambassador. Hungarian chocolate, not a Belgian one. I'm coming back. Thank you so much.
Thank you, István. Thank you so much. Let me switch off István's mic. Well, while he's leaving, I would like to extend huge gratitude to István for hosting us here today and for allowing for this platform for exchange. The aim of today's meeting is multiple. We want to emphasize the circumstances for civil society in general, and they're not sweet. We wanted to shed light specifically on the situation for European health NGOs, and then drawing from the case study of health NGOs to learn from colleagues from other civil society sectors how they are supported by their respective DGs, and then at the end to come up with recommendations for the sustainable funding for the civil society organizations. to not extend this kind of introduction what the event is all about, I would like to say that I'm delighted to see so many different sectors of civil society represented here today. We have obviously planned to involve the DG Santé and other DGs today in this discussion, but they could not be represented here today. István has set the stage rather well. And I won't go into too much detail. I would just like to highlight that the role of civil society, and I'm aware that I'm preaching to the converted, is really essential in defending democracy and the rule of law at all levels of governance. Civil society contributes to implementing and promoting EU values, delivering EU policy objectives, and supporting the most vulnerable and underrepresented groups in our society. We also provide expertise and inform the drafting and implementation of EU policies. We bring an independent voice into the debate, and I think that's a critical point to make here today. We give voice to the citizens, and we play the role of the watchdogs. And I think this role of civil society is especially important in the times of crisis, because that's when the gaps in our societies deepen, and that's when the most vulnerable among us suffer the most. And you don't need any better examples than the COVID pandemic and then the Russian invasion of Ukraine. István has also mentioned the trends observed in the EU civil society space. These trends are well recognizable and seen globally. When it comes to the health civil society, which I wanted to highlight the situation of today, we find ourselves in a position that despite the biggest ever health crisis in the EU and the biggest ever health budget since the establishment of the EU, in the summer of 2021, indeed, the DG Santé withdrew this funding framework that we call operating grants that is critical to support the NGO operations. Indeed, the operating grants were instated. We invested a lot of efforts into it. And when I say we, I mean the EU4Health Civil Society Alliance, which represents or which brings together more than 30 organizations working in health, EPHA with its 80 members, EPF, who supports the EU4Health Civil Society Alliance with their members. But also we had a massive support from the MEPs, from several member states, from Brussels media. They were reinstated, the operating grants, but only in an annual format. And that means that since 2021, every year, in addition to delivering on our work plans, we had to invest massive efforts into advocating, again, for getting the operating grants into the next year's budget. And the problem is that while the operating grants are critical for NGO survival, and there is no doubt about it, their annual nature really does not cater for the security and for the long-term planning and perspective that is necessary for our functioning. So I would say that, this absence of multi-annual framework funding by DG Santé leaves the health civil society especially vulnerable and disadvantaged compared to other civil society sectors, and held on a short leash, if you want. And our guard against the powerful commercial actors' lobby and interest is lowered. So the EU4Health Civil Society Alliance, EPHA, the Civil Society for EU campaign coordinated by Civil Society Europe, they have all called for a strengthened support to the civil society sector in general and for the better, more sustainably funded civil society sector. I would like to invite you to go through those three manifestos. There is some solid, good content in those. Now, just to kind of wrap up this scene setting, I would say the key message here to take us into the discussion is that if we are to make sure that the European democracy is thriving, it is critical for the EU to address the issues of the position, recognition, and support of civil society. And I would also say, while the message of support to civil society organizations is consistently strong from the cabinet of the Commissioner Kyriakides, I really wonder if we should be worried that no one from the Directorate General for Health and Food Safety could not join us here today. But okay, let's go now to the goods or good practice of the multi-annual operating grants. Why are they so important for us? To start with, they give the flexibility to us to develop our policy work. They bring a stronger balance in the interests that are represented in the different policy debates, and they allow for a stronger impact. If you think of the policy and advocacy work, it's never a sprint, it's a marathon. And we cannot do our planning, we cannot secure immediate impact in any policy or advocacy work, but we cannot do our planning and really deliver on what we are meant to do with very short leash and constraints by the funding. What does it mean to have multi-annual funding programs? That means that that applications for framework funding are normally kind of developed, prepared, submitted, and they allow for several years of funding, and then only the specific grant applications are delivered annually. And this was a common practice in all DGs, including DG Sante or Sanko before that, in the previous health programs. These multi-annual grants are still granted to other civil society sectors, and I'm really delighted that we have speakers from all of them here today to share their views and their experiences on how these funding programs support them in their work. So without further ado, I would like to start this panel discussion by inviting our panelists of today to share their experience with the EC funding programs and with the operating grants, describe the situation in your sector, and then also think together with us and come up with recommendations and suggestions on how the civil society can be better supported by the Commission with sustainable and independent funding. So before I invite Faustine to start us off, I would just like to ask you to switch on the microphone before you start talking, because then the camera will know whom to look at. So our first panelist for today is Faustine Bas-Defossez. Yes, okay. From the European Environmental Bureau. She's been Director for Nature, Health and Environment. I love the title. And she's been leading a large policy portfolio of the organization for a number of years, including biodiversity, water, soil, agri and food, chemicals, mercury, air quality, all that matters. And also part of the senior management team of the organization. So would you like, please, to share your experiences with your funding from the Commission?
Sure. First of all, thanks a lot for the invitation. It's a pleasure to be here. And as it was said by you, but also by our host today, it's very timely. There was a mention of Hungary, but actually it's very concerning that in other countries, and in my very own country, France, as you can hear from my accent, where no one would have expected that democratic rights would be severely under threat. No later than last week, the government decided to shut down an umbrella organization of environmental activists. This is, this was shocking for obviously many of us. And this is not isolated because it has started since several months, actually, even years. And there is that growing attack, let's say, against environmental activists in France, which is deeply concerning. Let's see how this decision will evolve. There will be an appeal that will be made, of course, by the lawyers of the organization, but still, this is a very, very bad signal. Especially at a time when it was said, I mean, obviously for health, we are in the middle of a health crisis, but we're also in the middle, I mean, it's all interlinked anyway, of an environmental and climate crisis. So the role of civil society is even more important than ever. So now looking at the core discussion of today and the operating grants, the EIB has benefiting from the life operating grant for decades, and I can fairly say that it's a crucial funding program for us, and that the EIB is in the position it is today and managed to do the work it has done for the past decades, thanks partly to that operating grant for sure. It is one of the few instruments offering funding of this kind, and as a network of over 180 organizations across Europe and beyond, you can imagine how important that source of funding is for us. And even more so, as I was saying, in the context of the crisis of today. And just to take comparison with other grants, other funding from the Commission, because obviously we're not only dependent on the operating grant, and one of the characteristics of the operating grant is that it is co-financed, so you have to seek for co-financing in order to be eligible, and we have increased that co-financing rates over time. We're now benefiting of the operating grant at 12% more or less of our entire budget. But still, it is significant and very important for us. But in comparison with other grants, such as Horizon, for instance, which is also very relevant, that operating grant really allows us to stick to our core work, which is advocacy. That's the core of our activities in the organization, and also put in place the tools that we need to perform it in the most efficient way. Well, we are involved in Horizon, as I said, and we also, welcome this source of funding. Some of them are 100% funded, so that's pretty good, the Horizon programs. And also they have generous overheads, 25%, which is also quite good for NGOs like us. It does add sometimes non-core work, like organization of events, which are very heavy, burdensome, not always linked with the policy timeline that is relevant to us. So it somehow deviates us from our core activities and work, and that can be quite challenging as, you know, the share of Horizon increases in comparison with the size of the operating grant for our organization. Now you were talking about the length. It is very good now for us that the life operating grant is a 3 years grant program. So we have a framework partnership agreement which lasts for 3 years, and we have to put forward every year, of course, an application for the specific grant agreement. Now, of course, there are also disadvantages. I don't know if you want me to go through the disadvantages as well, or if you want to do it step. Yeah, okay, then I'll. Well, the portal is not always user-friendly, and there is a little bit of, red tape associated with such grants to, to say it nicely. But what we've seen in the past, which we believe is quite problematic, is that there has been a tendency to blur the lines between a project grant, sort of grant, and an operating grant. And now we feel actually in the way we have to report against the activities and the work that we're doing, it is very much treated more and more so like a project grant, which is quite problematic because it prevents us from benefiting from the flexibility that we need, especially at a time of crisis like we are in now. I mean, COVID, you mentioned, of course, what's happening in Ukraine, but we know that it's not going to get any better in the future. So we need to be agile and to adapt, of course, in good communication with our donor, but we need to have that flexibility, and it should not take, a long time to actually be able to adjust. Otherwise, we are a bit paralyzed in our activities and in, our impact as well. So, we are also regrets that the decision that was made years ago for large organizations like us to lower the maximum ceiling for grants from 900K to 700K, because for us, for big organization, it had a disproportionate impact on our operating activities. In terms of the recommendations, and I will stop here to let others also speak. Obviously, what the sector needs is financial security. I mean, that was said, but more than ever, and adequate support, especially in difficult financial times, and in light also of the inflation. Obviously, I mean, we're based in Brussels, and we know that inflation is matched with mandatory indexation challenges, which is a heavy burden and a challenge for organizations. And that's why we need to have, you know, that flexibility in place and that support in place, because it's not always easy with other sorts of donors to actually explain that we have that mandatory indexation. It's not us, you know, increasing arbitrary our own salaries, but this is done, you know, by law, and we have to comply with it. But we found ourselves in difficult situation because of that with other donors. So yes, we need enough flexible and agile funding, as I said, especially because of the fast changing world that we are in now and the nature of our activities. Maybe another thing that I wanted to stress, given what you have said also in your introduction, obviously we need more coherence across the different operating grants. Not just for the length in your case, but also the eligibility criteria, like the size of the network, who is eligible, how many members you need, etc., because not the same across the different programs. And I can stop here, sorry, and leave space for the discussion.
Wonderful, thank you very much. And also thank you for sticking to time. Some interesting points there. I can't wait for the discussion part to kick in, and also quite some learnings for us, and I'm looking forward to exchanging further. But let's do the round through all the speakers today, and then we will open the discussion to free flow. I would like to introduce Carlotta Besozzi, the coordinator of Civil Society Europe, which is a wide network of European platforms of associations and NGOs that represent different sectors within civil society, such as human rights, environment, international collaboration, social inclusion, culture, education, health, civil rights, well, pretty much everything that forms life, if you want. You've been active in promoting and enabling the civil society space or civic space in Europe. And you have tons of experience to share with us. Notably, you're also a recipient of a SERV operating grant. So take us through your thoughts.
No, thank you very much for this invitation. I would like, I mean, I will not, I note that, of course, we have also discussion within civil society Europe, or different sectors around exactly the functioning of funding, the challenges. So there are also some things that were said that actually are very common to all of the sectors. Mainly just to maybe say something to put it in the general also context that was said. I think it's really important that this funding at European, I mean, there are different things, of course, at European level, and also which goes, of course, to organizations like European networks, that also grants that go to organization at national level, but for the support, as was said, of advocacy and the watchdog role, as you mentioned. And this is also part of the history of the EU, the European Parliament, who has given support for this in the past. It was, we can go back to the white paper on governance that recognized also this principle, and to balance, also to ensure that citizens have a voice through civil society organizations next to commercial and other private interest groups. Of course, now we are in a context of shrinking civic space, and the example that was given in France, we also have similar, unfortunately, examples with human rights organizations as well, are important, and there are a number of interesting documents that were issued not only in the Parliament but also at EU level by the European Commission in the context of fundamental rights and by the Council. But what is missing for this is, although there are also recommendations on funding and recognizing that funding, access to funding is a part of civic space, that this is really trickled down in a strategy. So that would be, and looking both at national funding, because also the gaps at EU level are also due sometimes to a lot by this lack, and the possibility also for other donors to be able to fund NGOs across Europe, and it's also linked to the issue of co-funding, but also how the EU funding is organized. So indeed, the fact that not all sectors benefit from operating grant is problematic. In terms of, we have also noted on co-funding, for instance, that not all programs have the same rules. So, and this was already a comment. So, for example, in SERV, where we are, so we have to provide 20% co-funding. Other programs is 10%, and others are more flexible according to the type of organization, the size, and other issues. So that would have to be for us to be reviewed. I think another issue that I would like to mention was it was linked to the inflation, and just also to complement that we have also the issue, for example, in our programs, we have the issue of unit costs, which should introduce a bit more flexibility, but in reality, yes, budgets are simplified, but your accounts are as complicated as before. But one of the problems is that they are not adapted to inflation. So we understand that now there will be a review of the rules, but still it's inflation. It's also fitting it with environmental concerns, because you get more reimbursement if you're flying and less if you're taking a train, for instance. So this is also an issue. There is also the issue, for instance, of some measures that have been introduced in terms of volunteer time, which would have to be better assessed. So as a possibility of co-funding, it's not too easy for every organization, especially if you don't have a large basis of volunteers, to use them. And also we note that, for example, volunteers-based organizations, because they do not have staff, have problems of eligibility, which was one of the issues that was raised. And in the server, maybe there is also an issue of consistency of interpretation of financial rules that we have. So that would be, in that sense, would be also good to really look at the different programs together, because the financial rules are the same. And just to say that in server, what is interesting is that we have re-granting mechanisms for smaller organizations that can also be used for recipients of operating grants, in addition to other specific measures which were really designed also for situations and organizations in countries where there are also big issues with the civic space. And it would be interesting, I mean, to revisit them a bit, but also to extend this possibility to other programs. I think maybe a final recommendation is also to look at the different possibilities for reinforcing capacity building for organization, looking at the different programs, also the possibility for civil society to be thought as an actor in different funding mechanisms. We have the examples of the recovery package. We have the example of now we are looking at packages of measure for Ukraine, and there is little consultation of civil society and also the role that European networks can play there, and also the use of instruments in shared management funding like technical support instruments. So these are, I think, would be really good within a civil society strategy to really have a dialogue. And also within programs, we see that in certain programs there is a good dialogue practice with beneficiaries and other stakeholders, but in others it's not the case. So for example, you mentioned the multi-annual issues in SERV. We are lucky, we have 4-year multi-annual, but we are not, although we have a civil dialogue mechanisms, up to now we have not really been involved in reshaping a bit these work programs, which is also linked to the issue of adapting the program, making it flexible according also to the different priorities. And I also subscribe to the comment that was made about, which is also linked to the use of the new database that makes that the operating grants become very similar to RISE projects, and that takes away that flexibility. Thank you.
Thank you so much, Carlotta. I have about 17 questions for you, but we'll leave them for later. Let me then introduce Floriana Cimmarusti, who is an international lawyer and Secretary General of the Safe Food Advocacy Europe. You're all over the place there, like you're managing the project and campaigns, you're lobbying, you're awareness raising on various issues that are related to health, the environment, the inclusion, nutrition. So yet another sector that we are covering here. And you're a recipient of the ESF Plus grant. What's your experience?
Yeah. So good afternoon, everybody. Thank you, Milka, for this invitation. I really find this meeting, this event, very important. I think it's not only important for the health sector, but in general, for the life of the future of life of our NGO. Just one thing to say in advance, I'm Southern Italian, sometimes I talk too much, so please, in case, do something with your hands or say it, because we from South sometimes talk too much. So first of all, why SAFE? SAFE, we try to represent European consumers during the EU food legislation process. And when we start was almost 10 years ago, we realized that consumers were not protected enough during the food safety process in the food legislation. That's why it was important to represent them in an NGO and an organization. However, where could we find the funding to do this, to organize this? When we realized that our members who are consumer organizations do not have the funding really to be represented at EU level, as for instance, many industry can have the opportunity to pay their organization here in Brussels from 40,000 euro till 200,000 euro being member. This is, of course, not possible for consumer organization at EU level. That's why I must say the operating grant was fundamental for SAFE to grow and to start our activities, either because our members could finance just a small part of SAFE. So thanks to the operating grant, we could start growing in our organization. Now, the problem is that, as all of you were talking about, is that the funding could have from the European Commission, the operating grant could be 60%, 70%, or maximum 90%, as is the case of ESF. However, if you have 60%, you need to have the 40%. But if your members, your consumer organization, do not have the economic possibility to pay their membership very high, the 60%, the 70%, the 90% you're asking to the Commission is of course in balance with the 40 or 30 or 10 that your member can give to you. So this is something that we always have to consider. So the power we could have as an organization is always, of course, limited to the funding you can arrive to have. When I was coming here this afternoon, I don't know if you noticed it, but there is displays at the entrance of the European Parliament where it's written democracy in action. So now people go down and take a photo there. And I always believe like the member of European Parliament is the institution who really try to really being the most democratic one, I will say. However, if there is a new legislation proposal and the MEP do not have enough position for our side, for instance, the consumer side, on the food legislation, and there is not enough representation of them, happened to me many times that some MEP call us to ask position paper on some issue. What does it mean? It means there is not enough. Why, as far as I know, they don't call so much industry to ask their position paper because they receive too many. That's because we represent the 10% of the 90% of all the lobbyists are here represented in Brussels. So I think this is really relevant that we exist and we find the funding to always growing. And although we SAFE is not just having this operating grant, as was saying by my colleague, we receive funding either from Horizon, from other projects, from foundation, etc. But the importance of the operating grant and why it's fundamental, it's even because give us the possibility to do all our lobbying in the area for us is very important, because often European projects like Horizon or others do not give this opportunity and this possibility. So it's really, the operating grant needs to be there in all sector, as others said, in a constant way, always in a similar way, but always thinking about the percentage that each NGO needs to put in to arrive to the 100% of the budget. We shouldn't forget that democracy is not only the opportunity to listen to each other, to represent our opinion, to protect our interests, but what is very important is to guarantee that those opinions are really taken into account by the authority, because even if we represent them, but no one is taking care of them, there is no guarantee of democracy. It's just to say four things I think we could, for the future, change. My colleague talked about inflation, which is a big issue, and all things changing in the world in the last years. The programs sometimes are very strict on timing. And as you were saying, Milka, to have 1 year, it's impossible to work on 1 year term. You're just running under administration, doing things, writing that you don't do the whole work. So actually your work is answering to the European Commission within 1 year. So the time you give the annual report, there is no time to work. So it doesn't work in terms of timing. And again, not enough co-financing, as I was talking about the percentage. And even to reduce a bit some administrative stuff, which sometimes is making all of us really crazy. Thank you so much.
Well, that sticking to time was very un-Italian. Perfect. Thank you. Thank you very much. Let's move then on to Diana Faccio, who is the development manager at Healthcare Without Harm Europe. Well, she's probably the best positioned of all of us to discuss this, because the lead of the organization's fundraising efforts is what she does. She manages the proposal development process and builds and cultivates the network of funding. So that's her bread and butter. So let's see. And also, by the way, the Healthcare Without Harm are recipients of the LIFE operating grants as well. So Diana, over to you.
Thank you for having me here today. So indeed, as you were mentioning, we are recipients of the LIFE operating grants. And first of all, I want to start with the positive aspects of it, because there are indeed many positive aspects as well. So I just want to recognize those today. So for us, it's really helped us develop us as an organization. It's supporting our own organizational development, which means funding for my fundraising team, but also communications, networking development, and financial management. And I just want to underscore how this is very important for an organization to then be able to have impact. And unfortunately, a lot of donors never want to fund these costs. They're often seen as so-called overheads, which is also how we call them when we apply for funding. And it's seen as bringing the funding away from the projects and away from the impact. But actually, if you don't fund these costs, then an organization is not able to act. So I just wanted to recognize that and the importance of that. I also want to say how important it has been for us to actually undertake our policy advocacy work at the EU level. And that's because, again, a lot of donors don't see the added value of funding policy advocacy work. And that's because it's hard to pinpoint impact, especially when your funding is limited to a 1-year or 2-year cycle, when we know that policy processes take a lot longer than that. At the same time, I think it's been beneficial, I hope, also for the European Commission, because us, working at the intersection of climate and health and environment and health, we've really been able to show how sustainability in healthcare is possible. At the same time, we see often the industry using healthcare as an excuse not to act on sustainability, saying, oh, but we need these products because the healthcare sector needs them. They save people's lives. And I don't want to enter into too many policy discussions today, but just to mention the PVC phase-out campaign we're undertaking at the moment. The industry often says PVC is needed for healthcare, but we're showing how in many instances we can use alternative materials that are safer. So hopefully we also bring an important independent voice to the policy debate. Perhaps just to underline also a few disadvantages or challenges, I would say, when working with the Life Operating Grant. So on one hand, and I think I just want to build also on what Faustine was saying, is that often we end up including activities which are more about project-based funding, and that's because of the co-funding requirements which are imposed on us. As I was saying, a lot of donors don't want to fund policy advocacy work. So in order to meet the co-funding requirements, we end up including activities which perhaps are not ideal for an operating grant, but it's the only way for us to meet that co-funding requirement. Again, I would actually, and that's one of my recommendations, ask to scrap the co-funding requirement, because if you think that a work plan is valuable in and of itself, why do you need someone else to fund it? Also, the co-funding requirement limits our flexibility because we need to find other donors outside of the EU space, because we know that we can't use other EU funding instruments to meet that co-funding requirement. We need to find other donors who are willing to fund that work plan. And again, as I was saying, it's very difficult to find a donor interested in policy advocacy work. Also, one thing, a challenge we've been experiencing is that last time that we applied for a Life Operating Grant, we wanted to ask for more money than we asked for in the past. And since they were quite happy with our work, they said that we could do that. But at the same time, they suggested we increase the co-funding so that we had to show we were securing more co-funding for that increased amount. So again, although it's called an operating grant, it's not actually giving us the flexibility we need. How do we go about securing other operational costs? So as I was saying, it's very challenging for us to meet the co-funding requirements, and the only way we can do this is by cultivating relationships with foundations. So I don't know if foundations are listening to us today, but I would also like to make a call out to them saying that funding policy advocacy work is very important. For us, it's one of our scaling strategies. It's the way in which we can really deliver impact long term. And also a call to foundations to fund the true costs of an organization, so including the operational costs. I also wanted to pick up on what Floriana was saying about the challenges of working with a one-year plan. And alongside my request to avoid co-funding requirements, I would also like to mention that whilst we do apply for a multi-year operational grant, then each year we're requested to submit again an application called the SGA, the Specific Grant Agreement. And so my question is, if we want to fund multi-year, then why do you request a yearly application again, once you've already approved a multi-year work plan? So I see a bit of inconsistency there, and I think we could do better. And then, well, to touch upon, of course, I guess just the paperwork and the reporting requirements, of course, they are very challenging. I think, though, that they have made some good steps forward with the Life Operating Grants, simplifying some of the financial management. But I think a bit more could be done. Even just looking at how other foundations ask us to report back, there could be simpler templates used, making everyone's life easier on both sides. So I think that's all from me today, but looking forward to the Q&A and discussion.
Wonderful. Thank you very much, Diana. That leads us then to Dorota Sienkiewicz, the EuroHealthNet policy manager. Dorota leads the policy platform within the EuroHealthNet, providing policy advice and intelligence to the partnership, developing consultation processes, liaising with the EU institutions and the EU public health and social rights stakeholders. So actually doing what we all say that the civil society is doing. You receive the ESF grant. What's your experience?
Yes, thank you so much. Thank you so much, Milka, for inviting us to this extremely important conversation, sitting at the table today. Indeed, EuroHealthNet is a recipient of the ESF Plus operating grant from the Employment and Social Innovation strand. There are two, the other one is SERV. Indeed, what you said, what I'm doing with my colleagues based here in Brussels, delivering on all the most hopefully critical roles that the civil society is playing and contributing to the policy, practice, research, making horizon, I'd say. Just joining the voices of colleagues who already spoke actually on behalf of the ESF Plus operating grants recipients, we've just submitted another application for the next year operating grant. So that will be our third year. We are receiving operating grants from the Framework Partnership Agreement for 4 years. So I think that was already mentioned before. So I see there are some differences between whether it's Life Plus or ESF Plus, etc. Nonetheless, having a multi-annual a framework that sets our work already at the start of it, and then enables us every year to adapt slightly to the changing realities, and that's certainly the case of the political climate and adjusting to crises as they occur, health crisis, the climate change emergency crisis, etc., and the rising cost of living crisis. That's the flexibility is basically there, and I have to say that with regards to the ESF Plus, already last year, DG Employment raised the co-funding rate from 80% to 90%. And nonetheless, I have to say that there are of course some challenges, as in some of the allowances for spendings for travel, accommodation, etc., have been set for before the inflation happened. So I think, if I'm not mistaken, the prices are set for 2017 or 18. So that makes it slightly challenging to be able actually to cover all the operating costs. But yeah, there are advantages, as I said. I mean, what I wanted to basically say is that, in my view, arguing for multi-annual operating grants is, as the probably most sustainable, stable yet flexible form of rewarding civil society and the civic space in delivering on the critical activities that they do. It's really a question of the functional democracy. We've heard that word already many times today, and also improving the overall good economic governance of the EU. And I think this is probably, I mean, in my view at least, the basis really of all the conversations we have here. It's not about poor CSOs or poor NGOs coming and demanding more money, an issue of absorption, the capacity to absorb and really deliver on that is another part of this this narrative. But it's it's a kind of rewarding for creating and nurturing and maintaining the societies that we want to live in. Yes. What I wanted also to say that it's true that, and you mentioned that, Milka, we are in the middle of the health crisis, climate crisis. All of it is really connected. Never before have we had such a big health budget at the EU level. We don't know what the future is now with the revision of the MFF that's been just reopened. The future was, unsure again. But I want to say that, the multi-annual nature of the operating grants allow us to operate in alliances, operate in partnerships, look forward proactively, shape the agenda, not be just reactive to do stuff today or in a very short, limited, narrow period of time. But yeah, look ahead 10, 15, 20 years ago, ahead. And the kind of feel the collaboration and support that we have with others. I mean, many issues were already mentioned, so I won't really repeat myself, and I'm also looking forward to the Q&A session. So I think I will just finish here, but thank you.
Perfect. Thank you so much, Dorota. Last but not least, well, we don't have really the perfect gender balance here today. Okay, Freek Spinnewijn, the director of FEANTSA, which is the European Federation of National Organizations working with the homeless. Freek, can you give you a little bit of a background on FEANTSA itself? But it is a very social NGO working very much on the ground with people with real needs, where the contribution from the civil society is really crucial. FEANTSA is also a recipient of the ESF Plus grant. So Freek, what has been FEANTSA's experience?
Thank you, Milka. I was actually going to mention the gender balance, but since you mentioned it, no need anymore. No, I think nobody said it so far, but I think I should say it also because I have been president and vice president of EPHA over the last couple of years. The way DG Health has managed the OPGs and the relations with organizations receiving OPGs has been an absolute disgrace, I think. Like if I have a lot of issues with DG Employment and receiving the grants, etc. But compared to what you have experienced in EPHA, I think we're in sort of heaven. And I think the officials in DG Sante, DG Health should be aware of how terrible they have managed that over the last couple of years. That's the first thing. If I look at the ESF grants, it's a program within ESF, actually. It's an easy program, and it is rather easy compared to what you experience. But I think there's 4 positive things. I mean, all in context, because it can improve, of course, hugely. I think DG Employment accepts that you need to have some kind of a longer term approach, and the 4-year partnerships are actually quite welcome. And it's true that we have to apply every year with these specific grant agreements, but actually it's relatively easy and straightforward. So that's appreciated, that you have some kind of security of funding for 4 years. The second thing is that I feel that DG Employment recognizes the role that European NGOs play as partners to make progress on their own priorities. So we're really helping them to deliver. That's recognized. I don't think that is much debated anymore internally. I also think that in DG Employment, there is a recognition that there is a shrinking space for civil society, not only at local and national level, but also at European level. And also at European level, you can do something about it. I don't think it's a surprise in that context that DG Employment funds probably about 30 NGOs, 30 European NGOs at the moment. They want to play that role, you know, to sort of strengthen civil society, because it makes sense to do something at European level, even if you're concerned about national level. You know, that is a link. So that's also helpful. And then the last positive point that I experienced with DG Employment is that they understand the reality in which we work to some extent. Not always, but the fact that we have 90% co-financing or 10% co-financing. Yes, it's 10%, but I think it's doable. You know, like I work in the homeless sector. There's not lots of money in the homeless sector. The 10% is really possible. So that's, I think, a recognition from their side that there is little money in the NGO sector, in the social NGO sector, so they use the maximum. The adaptation of the work to the budget to inflation. Last year, we got the opportunity to adapt our salary budget to inflation. Next year, we get a 10% increase overall for the budget to deal with inflation. Like these kind of things are quite positive, and I applaud DG Employment for that. But there's of course some negatives as well. It has not been mentioned so far, but we cannot see our own situation without looking at the growing role of commercial consultancies at the same time. And that's really scary, I find. I advise you all to look at the Financial Transparency Register. It's very boring website, but fantastic information in there. If you want to get a sense of how much money these commercial consultancies get for stuff that we have been doing for years at a fraction of the price, it's really worth looking into that. This morning, I was looking at one of the consultancies, I will not name them, that has done some mutual learning events for the European Commission at more than 100,000 euro per event for hardly 30, 40 people for 1.5 days. That's crazy, you know? And I think if we are confronted with the fact it's the money or there's not more money, etc., like please, maybe try to do something about the growth of consultancies that actually more and more do work that NGOs used to be doing. Awareness raising, policy preparation, policy evaluation, that's what we are good at. Why should that be done worse and at a higher price by consultancies? That's the first negative. The second negative is that I hear also from DG Employment very often, you need to diversify your funding. And I think we're so obedient when we hear that. We should resist that kind of mantra from the European Commission. If I look at the money that DG Employment gives to the European Trade Union Congress, the Confederation, the trade unions, it's more than 10 million, if I'm not mistaken, every year. They're totally dependent on EU funding, but I don't hear them saying we should diversify our funding. I think it's perfectly okay for some NGOs to be entirely dependent on public funding. You know, like that kind of logic we should challenge, especially because it has been said, funding from foundations can never replace the operating grant, the money you need to operate as an organization. So let's collectively try to break down that kind of mantra from Commission. And then, of course, it has been said several times, bureaucracy. You know, somebody said that the funding portal is not so effective. It's a disaster, this thing, like really. Like every time I open it, it's really, it's badly made as well, you know? So I don't know who made that kind of funding portal, but it makes no, consultants, obviously. But like, I think in the bureaucracy, the Commission is so worried about how we spend the money and so little worried about the impact we actually generate. Maybe a little bit less focus on how we spend the money and a bit more focus on how useful we are as an NGO. Could be helpful. To conclude with a bit maybe a provocative, like a provocative thought, you know. I think we have to be careful to give the impression that all NGOs are good and effective because they are NGOs, you know. I think our lobbying should be much stronger if we say there is useful NGOs and less for useful NGOs, because that's the reality also at European level. And I think we come from a time, I'm 20 years in FEANTSA, way too long, I should definitely move on in the future, but I think we came from a very comfortable position where we were funded to just annoy the European Commission with asks. We ask more this and more that and better this and better that. I think in the last couple of years, we have seen a change in the social area, we've seen it with the adoption of the European Pillar of Social Rights, where there is a whole range of issues that are now priorities at EU level, and the Commission turns to us to help deliver. So this comfortable space where you can just ask is gone, and you have to deliver. And I think some NGOs struggle with that. But I think it's quite okay for the European Commission to say, we fund you because we think you're a key partner to help us deliver on the priorities. So that requires a little bit of change in the way we operate and we present ourselves as partner, but also change from the European Commission on how they work with us as true partners. And DG Employment is going the right way, but it's not fully there. And a last thought to conclude is on DG Health, DG Santé, again, I find it quite stunning that if at the political level, the leadership, the commissioner says, I think it's important that European health NGOs get funding, that apparently the officials, the administration, the DG, finds it possible, thinks it's possible to say, well, actually, that might be the view of the commissioner, but we think differently, and we're still not going to do it. Like, that should stop, you know, like, I think if you manage to convince the commissioner, the administration should follow. It's unacceptable that there is that kind of double, parallel universes, because that makes it impossible for us to work. That's what I want to say.
Well, I'm really glad we didn't have the right gender balance, because if we got more of that, we would probably be here kind of discussing angrily till tomorrow. Thank you very much, Freek. I'm thinking now in terms of logistics. Shall we pick up the questions that were kind of raising from the discussion by myself, or shall we maybe open the floor to the attendees of the event and maybe ask first, do you have any questions to the speakers? Let's do the latter. Any questions?
I will be very short.
Don't forget to say your name, your organization.
Sorry. I'm Milan Mišković from European Liver Patient Association, a board director and person for the communications. Today it's my pleasure to be here. And this is excellent initiative where I see a lot of potential and hope in the future that we will change something. Why I'm speaking? We attack all the challenges from different kind of aspects. But what we forget to mention is that in the moment about health, when we speak in the European Union, we have a lot of bubbles, which are fortunately not under the one committee. I'm speaking committee. Maybe one of the challenges in the future is that we to provide a committee which gonna collect all these bubbles, agencies which are existing somehow in the area in the moment, especially after the COVID-19. We know that in the new structures coming a lot of other agencies and a lot of other committees, subcommittees, which are trying to be part of this health issue. And after that, because we are speaking about the health, and was mentioned that the health is a little bit not like more or less the other DJs. How the parliament can help in this position? I see a lot of things the parliament, how can help us in the future, especially if we discuss now, if we open the subject, because if we see the well-being for the patient in the next period, I see a lot of hope that this EU Health Union question, which we are trying to raise, especially the past 2 years, really to make something, let's say, mission possible in the future. I'm coming from the liver field. Also, it's very tricky because I see a lot of, let's say, somehow, some people say to me, a lot of big organization. What's mean big organization? Also, it's a question. For example, in this moment, in the liver field, we have huge problem and burden because we have more than 200 million people in Europe who have a problem with the liver, with NAFLD, non-alcoholic fatty liver disease, alcoholic, and hepatitis, 30 million people. And what is the response here? Do we have equal response from the member states, from the Commission? We have, for the first time in the history, a chance to eliminate such a dangerous disease for hepatitis. We have action plans, we have strategies from WHO, from everybody. But through the EU Cancer Beating Plan, we see a good opportunity now through different kind of fundings, organizationals, NGOs, also member states are very important. I will open the discussion. It's not just how to fundraise ourselves if we like to achieve some kind of input, because we really like to see the input even to the member states. From here, from our discussion, really, I'm using every time when I have a meeting on the national level that I'm here with István, with all of these people, how we're raising these questions here. And I must be honest, they like to listen when it's coming something from here. Really, they like, especially if you address also with us on the national level, with some recommendation in some kind of position, it's coming, let's say, some beneficiaries for us. It's very important, the work on European level, but put boots on the ground. And the fundraising to this, let's say, operational grants, for us, I think it's somehow, let's tricky in the moment, how they are given, let's say, how they give them, who is available or accessible to reach this. The input, which was mentioned previously, how is the measurement for the Commission, not just how we spend on the end of the day, really. We need to have some inputs, what is going on behind of this initiative, which is done. Yes, we have a lot of organizational, let's say, challenges, but between them, we are working on the ground and we are delivering some kind of, let's say, services already established. This is very important to be somehow synchronized in the future. I'm seeing this, the Parliament, that can help a lot.
Thank you, Milan. That links to the question of eligibility. So what you mentioned at the end, how are the decisions made and how are the organizations judged or evaluated during the process? Any comments from the panel there? Someone mentioned, I think Faustine mentioned the point of coherence and eligibility criteria, and they can be seen from different angles. The organizations like the Liver Patient Association, who do not receive, I believe, the operating grants from the Commission, need to find a different way of funding. Foundations will not necessarily fund patient organizations. That means that we have to go to the industry as a source of funding. How do we cut that knot? I don't think we can detangle it. We need to cut it. How do we cut it? Any thoughts?
Sorry, may I ask something? Because we had lots of fight here in the Parliament to have the EU4Health budget, and it's okay. It's not the biggest part of the European budget, but it's 12 times bigger than before. I had lots of fights because of it here in the House. And I realized that I met with the HDA several times, and they promised me they will open grants, supports, tenders for the NGOs. Is it correct? So have they started it or not? Because as a decision maker, I have this information. And of course, I'm not there every day to check who got and who doesn't have any kinds of support. Is it not true?
Maybe I can take on
Yeah,
that one,
please.
yes. So in principle, the operating grants, as we said at the beginning, were reinstated, but it is only 18 NGOs that receive operating grants from DG Sante in 2023. Freek was mentioning 30 by DG Employment. It's not a massive number, and of course the Commission has their own criteria based on the excellence of the proposal, based on there are all sorts of eligibility criteria. The one I mentioned about the previous funding. How does an organization ever get out of, for instance, industry funding if those eligibility criteria are not changed is a different point. But to your point, yes, the operating grants are back. There are 18 organizations at the EU level that have received funding from DG Sante, from the EU4Health program this year.
I like to just to say something. What is very important, because you mentioned that more or less we are funded from the industry. We try and struggling, especially the past 3 years, 60% of our budget, even we are not anymore from the industry. We're trying from different kind of approaches, philanthropy and let's say, combining with the research projects which are coming from the European Commission, but also that need huge work also collecting consortiums, I don't know, partners and everything, which is big challenges. And also ELPA, it's like a patient can be a leader partner in that projects, but it's good that we are there and we are getting some research. In the moment we have a lot, 16, 70 projects we are running in the same time, which is giving let's say accessibility, affordability, and in the same time that we are some kind of eligible for the European Commission, but still we have the challenge to get a real grant, operational grant from the Commission.
Thank you, Milan. And that goes back to Freek's comment on not all the NGOs are good NGOs. There should be very clear criteria on who receives the operating grants. And that's also something that needs to be brought back to the discussion. Please.
There is something more, like the European Commission cannot fund, not even all good NGOs. I think that's also a reality. And I think in DG employment, there is some stability, I think, for years, because if you look at the priorities that are covered by the Pillar of Social Rights and the action plan of the pillar, they have probably all the key ones that they need to have to deliver, you know. But I heard, I'm not going to mention the actual number, but I heard that when the call for the OPGs in health was launched, that there were so many. Like, I couldn't even believe it, how many there were. Like, of course, that's an impossibility. I think the health NGO sector will have to organize itself in such a way that it makes sense. You know, that doesn't mean that European Commission, DG Health can spend a bit more money on European NGOs. That's clear within the budget that is available. I don't see that a doubling of that budget should be a problem, but that will not enable them to fund all the NGOs that will line up to get funding. That's clear. Yeah.
Thank you for that, Freek. We have one question over there.
Thank you. This is Carlotta from the European Patients Forum. Thank you very much for this very important event. Indeed, I agree obviously with everything that has been said, and just to note as well that we're asked as NGOs to do more and more as well. You know, we're involved in so many working groups and we're asked to provide input into so many initiatives, you know, and these the time that we spent on this is actually not recognized. So, okay, if you want to attend an event and you have costs to attend the event, the costs are covered, but the time that is needed in order to prepare for these meetings is not covered. And so really the gaps, you know, are there in terms of being able to fund our activities. And as far as the operating grants, at the moment EPF is not eligible, and we would have to turn off the lights for 2 years, basically, in order to be able to apply for it. So here is a problem. But just to go back to the presentations and the very helpful presentations today, I'm struck, you know, as to the differences between the different DGs and how can we reach some kind of consistency, you know, in the way that every DG deals with that type of funding and with how the Commission in general treats the NGOs at EU level.
Maybe that's a question for Carlotta. So how do we enforce the civil dialogue on this matter? How do we get better organized? How do we reach the point that Freek was suggesting that the health NGOs are better organized among themselves and also that we are all equally treated across the sectors?
Well, I think it would be, there are different measures can be taken. One is really to have a dialogue with the different DGs and DG budget, and maybe also the Parliament could possibly play a role there in terms of the evaluation of the programs. Also, I would say a positive role, because on one hand we have these very useful discussions in many committees, and then we have also in the Budget Control Committee some discussions about the transparency and accountability NGOs that go into a very different direction. So it would be really good to really have this discussion and have a review as well. Maybe suggest also a review of how the different DGs deal with the funding of civil society. How much yes, they deliver, what type of operating grants, what mechanism they have, what co-funding, that could be really useful to be requested, I think. And also on the other hand, I think is also to encourage better dialogue mechanisms on the funding programs within the different DGs, which can involve both, I mean, in those that where they exist. I think in DG Employment, you have this for the EASY. There is also in the, for DG INPA or ECO they have, it can involve, for example, also non-beneficiaries. In principle, in SERV, we have it, but they haven't launched it yet. So we are waiting and so I would suggest these things and to review the different things, including the eligibility that was mentioned, the issue of also of measuring the impact of the work versus fitting some ticking boxes, because that's also the problem that we have, and that we can see also in the evaluation of projects, that sometimes the evaluation is also poor because it's constructed on ticking box and not really on evaluating the quality of proposals. Yeah.
It seems that neither the Civil Society Europe nor EU4Health Civil Society Alliance will be bored in the coming years. Freek.
Maybe to say that we have to also make a difference between civil dialogue and funding for civil dialogue and the funding of European NGOs. Because civil dialogue basically should allow organizations to speak on behalf of their constituencies. But I think funding of NGOs goes further than that. And like I said before, you can be a delivery partner of the European Commission. And I think we have invested too little energy in enlarging that field of work, because operating grants are part of the solution, but DG Employment uses action grants. You can combine an operating grant with an action grant. Why can, for instance, DG Employment has framework contracts with big consortia of consultancies for communications, for mutual learning? Why can such framework contracts not be used for the NGO sector, for instance? That is, as long as you accept that the European Commission has some say over what you're supposed to do. But I think we have to also be a bit confident that we as NGOs can also make the European Commission ask us to do what we think makes sense, you know, if you understand what I'm saying. So I think we shouldn't always get bogged down with the operating grants. There is other areas that we can explore in terms of funding to reinforce our role as delivery partners of the European Commission. But then you have to deliver on the priorities that are set. You know, I think it's something else asking funding to set new priorities in the European Commission and being a delivery partner on the priorities that are currently there.
Which we are required for both, no?
Yes, yes.
Yeah, yeah. Diana.
Yeah, just to add something on that. It's really interesting what you say, and sometimes I find it a bit strange that with the action grants, they are so prescriptive in what we have to do. So in a way, it feels as if the Commission already knows what the answers are to an issue, and maybe they do, but I think it might be interesting for them to perhaps state what is the problem that we have to solve, and then give more space and liberty to be creative and innovative in coming up with the solutions. But I don't see that much when we apply to even Horizon Europe. Action grants, it's very specific in the scope of the activities. So maybe that would also be a request to the Commission.
Another good piece of advice, thank you. I find, Freek, what you're suggesting is a little bit contradictory what you were suggesting 10 minutes ago, which was there is no wrong with being dependent on the operating grants only. So there has to be balance. We have to find ways to kind of combine the two, because this is actually supporting two different roles of civil society. Yeah, yeah.
It's actually not contradictory. I think it's no problem to be dependent for your existence of the operating grant, because if you're really honest, most of the, certainly in the NGOs funded by DG Employment, if DG Employment would decide tomorrow to cut their funding, quite a lot will die immediately. And I think it's no problem to admit that and to say we depend on the operating grant for our existence. But that shouldn't exclude to, as a delivery partner, to actually dig into other sources of funding.
I had a quick cheeky question for you, Dorota. You were a recipient of DG Santé's operating grants, and then you moved to DG Ample. What was the reason?
Thank you. What was the reason? That was before I joined EuroHealthNet, so I hope I'll be accurate when I say operating grants, or let's say funding for activities to deliver on the priority, let's say, of Santé, or back then Sanco, were not really totally in line with our perception of what health is or should be. Very much focused, and it's still the case, I have to say, on healthcare systems, workforce, the typical kind of traditional, let's say, biomedical approach to health, doctors, medicines, beds, hospitals, etc. While our kind of mission vision is to work on preventing diseases, so very much working on the preventive solutions, let's say, and promoting health, reducing health inequality. So let's be positive, promoting health equity, and we do that by addressing or working from the socioeconomic determinants of health perspective. So all the issues related to employment, income, education, etc. And we didn't really see it reflected much in the mandate of DG Santé, Sanco, whatever. That's why we thought maybe we go look for funding somewhere else that would allow us to work as we see it. And indeed, I think we made a good choice, seeing what happened all those years ago, and all the mess, where unfortunately I have to say it, so that was the reason. But can I add what I really actually wanted? I lifted my hand. Just the kind of coming back to what Freek was talking about, which is being recipient of an operating grant and being able to merge it to a degree with working on issues that are covered or funded from other action grants, EU funding streams, etc. I think that's an interesting way of working, and that enables us, a kind of to pool the resources to a degree, not to avoid duplication, work with new partners in the field, and that's certainly the case, for these kind of working across sector with environment, climate change, and now taking more and more on the commercial determinants of health, which is really increasingly a case. But for that, we have to really invest a lot in capacities. Because in our case, our core members are authorities. They are not skilled at all, a lot in working in this way. So that's kind of very long-term planning that will hopefully flourish, let's say, into people being able to work more in collaborations on a kind of multiple issues, and so on and so forth. Thanks.
Thank you very much. I'm aware that we are a little bit over time, but our kind host has allowed us to stay here for a little bit longer if the discussion is lively, which is the case, thankfully. So for those of you following us online, please stay with us for a little bit longer. I have 3 hands, so Faustine was first.
Thank you. Yeah, I just wanted to build on what has been said. It's very rich indeed, and very interesting. First, maybe on the lack of consistency and the lack of coherence, something that, has not been said, but it seems that there are differences indeed on the way these different grants are managed. In the case of the life operating grant, it is an agency, CINEA, which is managing it. And I understand that that's not the case with DG AMP. And it might also be a bit of a challenge because the people in the staff in the agencies are quite remote sometimes from policy work. And, you know, in the way they evaluate, the impact, you know, is not always, not wanting to criticize them, of course, but, you know, not always optimal. So, yeah, something to bear in mind when we compare, if there is a comparison that is done also between the different grants and what the pros and cons of having an agency managing the grants. Another point that I wanted to build on was the diversification of funding, and which should not be a mantra. And in our case, as I said, actually we are less and less dependent on the operating grant. Now it's around 12%, but yes, we had to diversify quite strongly our sources of funding. And as it was said before, we do rely a lot now also on philanthropic sector, on foundations. While it is positive in some case, you know, I mean, they have lots of flexibility, reporting is much easier, lighter, etc. I see also a risk of the image also that NGOs can have. We are more vulnerable because of that, of course, because then behind foundations, you know, often have something, a company, or, you know, of course, we all have to do due diligence, etc. But, you know, there are limits. And I think that there is a risk that, you know, this will backfire, even though, you know, we're doing that for the good, obviously. But I see a risk coming given the trends. And I don't have a magic solution here, but, you know, obviously having more public funding to avoid that we become too much relying on that private source of funding from philanthropy, you know, might be the way forward. And last point that I wanted to build on, again, on the commercial consultancies that was made as well. Indeed, that's a major trend, and I know that there is more and more research on that, and I hope that it will be soon out. But that's an issue, and we see a lot of consultancy. Very big ones conducting all the policy evaluation now, and they are they have very little understanding, you know, of the EU scene, how it works, and it's because they are big machine and they know very well how to respond to a call, and, you know, because it's quite, you know, you have certain way of this being evaluated, etc., and they know exactly how to do it. But the quality of the work, I'm quite concerned also about that, and I think that this is something that we should really bear in mind.
Thanks for that, Faustine. Just a comment on the LIFE and CINEA. There is a similar setting with the EU4Health program and HDA, and we see a similar disconnect between the agency and the policy work of the DG Sante. Floriana.
I just wanted to to underline that SAFE has been financed for the first 4 years by the LIFE program. We receive operating grant from DG Environment and then CINEA. And then from the last 4 years, DG Employment as other NGO who are here. So the reason why we have changed is because there was a moment, you never know how things could go. So we try either for the LIFE program at the same time for the employment, and we've been lucky enough to receive both acceptance, that we have to choose one. Why we have chosen employment? For all positive things have been said till now, but above all because the LIFE one was before 60%, now it seems 70%, while employment was 90. One is 2 years, so now it's 3 years, and the other one is 4 years. So at the end, actually one of the main reasons is even practical reason, like how long it is, how much funding you can get. The program was very similar from both DG, and of course we were very lucky to having been chosen by two DG. But however, the type of decision are based on those type of information, which percentage, how many years, and how much difficult is for one, how much more easy for the other one. That's it.
Elizabeth.
Yeah, I will try to be short. I'm Elizabeth Dupont from the International Diabetes Federation Europe. Thank you very much for the discussion. This was immensely interesting, and I really learned a lot. And I have many questions. So I will stick to a few. First of all, I was very interested by this question about why you switched from one operating grant from one DG to another one. And I feel that also reflects this silo approach that we have way too often. And in the health sector, the silo approach is very worrisome for many of the organizations, but specifically for people living with chronic conditions, because we know that living with chronic condition, you have, you know, all these health and socioeconomic issues, etc. And then you have this more specifically health issues. So it shouldn't be two different budgets or two different operating grants. It should be something that is more interconnected. But saying that, we don't get any operating grant either. And I'm quite surprised to see that the three health organizations, patient organizations here in this room do not get operating grants. So I think if patient organizations who are supposed to be the voice of the citizen do not get the operating grant, there is something definitely very wrong. So maybe I can just stop here because I have a list of questions, but I'm very happy to have the contacts that I can go to afterwards. Thank you.
Yeah, so your question, sorry, was why we switched from the environment? No.
No, I heard your answer, but I felt that question and your answer was very interesting for me, because it means that you cannot, you know, have an overall approach on issues that would fit under various different DGs. So, for example, diabetes is very much a disease for low and social economic, from people from low social economic levels. So it would definitely fit under, you know, DG employment, as you mentioned, because there are quite a number of issues that are related to the quality of the earnings they have, etc. But they obviously have all the issues related to health. So for me, it would make sense that, you know, there would be operating grant that would go look at the issues in a more holistic way and not, you know, remain siloed. But
let's say we work in the area of diabetes too, of obesity, of partly of health from the consumer point of view. And I cannot go really on all the detail of the call of DG employment because it's very complex, but you can have a lot of issues related with each other in one operating grant. So they can be, and the same it was with the life at the time we're doing live. So I have to go too much on the tail of this. You need really to now I don't know your organization, but I think it's a very important being independent from industry. Try to get your funding in a way that you're really independent in your voice and the way you represent. And I think a lot of NGOs who are financed by some operating grant has this independency and believe in it and work for it very strongly. I'm not sure if your organization is like this because I don't know it, but a lot of diabetes organizations, a lot of them are financed very a lot from industry, even more than 10% or 5%. So somehow that's very important. It is very important that I think they have the feeling that their financing organization really represent people, consumers, citizens, and there's not so much a strong voice from industry. That's what I suppose it is an important value, which I'm not talking about yours. I was just in general of I don't know your organization. So.
But okay.
We had two hands here, Freek and then Dorota, and then we will wrap it up, and then we will discuss all those funding issues among ourselves. Freek, please.
Two very quick points. I think that DG Employment is increasingly aware of its generous or more generous funding system, and I wouldn't be surprised if after this partnership agreement, they will become a little bit more strict, for instance, on the teams that they fund, because there is a gray zone of organizations that probably could be pushed to other funding programs. And I wouldn't be surprised if that's going to happen. So I think we can probably exploit a little bit of divergence, but we have to be careful, because it might also lead to DG employment becoming more strict rather than the others becoming more generous. That's the first point. But you were talking about solutions. Like, I think one of the things that I would like to see changed is the recognition by the European Commission, all DGs actually, of organizational expertise. In their vocabulary, it doesn't exist. Like, if you want to make the case to get funding to do some work, you have to send a CV. But you cannot send a CV of an organization. You know, in Horizon it's the case, in tenders it's the case, etc. And I think one of the reasons why consultancies are so successful is that they work with individuals and not with organizations. And I think some kind of a recognition that an organization has expertise, a network and organizational expertise, and that you don't have to say, well, that will be the person working on the project or on the funding, but the organization will be there. That should be sufficient. And I'm getting really tired to justify the European Commission why my organization is involved in one or the other project without giving them the CV of an individual. That would strengthen a lot the NGOs, I think.
Thank you, Freek. Last comment from Dorota.
Yeah, I don't know whether I should actually bring it up. No, but I wanted to, in terms of like, switching from one operating run from one DG to another, and I just, not to complicate it even more, I think we should maybe even think about it like what happened back in, I think 2018, 19, where the Commission actually, the original idea was to merge EU4Health with the ESF Plus, and that was the original plan. And then COVID happened, and EU4Health was taken out of it. And I'm just wondering whether, there's some on a way, kind of loads of mistakes happened. I don't know, like whatever. That this the operating grants for the health NGOs didn't kind of pass through with it. So I think there was an intention to indeed kind of break the silos between the health sector, social rights, anti-poverty, etc. So I don't know what the future will bring. And again, I wanted to bring it back to and I don't know whether that's an opportunity, a window of opportunity, or a risk, a threat. And I've been looking for information what reopening of the MFF now holds, like who is working on it, and how we can make sure operating grants within the revision of the MFF will be really a kind of, structurally taken on board again until 2027 for the years ahead. So just a couple of things to add to that. Thank you.
Thank you very much, Dorota. Let's hope it turns into an opportunity and not all the DGs scrape all the operating grants. Okay, so before passing the word back to István, I think we all absolutely agree that the multi-annual framework program allows for maximizing the value and minimizing the burden of funding, both for civil society and for the Commission. And I think I can also promise on our all behalf that we can keep working on comparing and missing the words in all languages again, comparing the existing programs, trying to kind of bring the civil society in the same space and into the same area of opportunities. And again, before passing the words to István, I would like to thank you all, the panelists and all the attendants, for very lively and useful discussion. I would also like to thank the team EPHA and team EPF who have helped us to deliver this meeting or this event on behalf of the EU4Health Civil Society Alliance. And many thanks to you, István, for hosting us here today despite the busy schedule.
Thank you so much, Milka. thanks for Zoltán, he organized it. First of all, I would like to ask you, I think you made a notice or something like that, because for me it would be interesting to have a guideline, something to understand it, not 10 pages, but concrete points about the situation. And I will share it with the colleagues here. We know who are interested to be informed. So we can do it. It's useful for them, and of course it's useful for your campaign, your movement. Second, please, it's not unpolite from myself, but you will understand. Please tell me who has from your NGOs, civil organizations, who has Hungarian members, not individual members, official members, national organization. You are very good. But ask Zoltán, I always ask my guests, and most of the time they don't have. And when I ask, do you have only one professional? No, we don't have. But they arrive to me on behalf of 5 million Europeans, 6 million Europeans, different sectors of different diseases. And I think if we would like to have a useful work, then we have to mobilize the local level, national local level. Because finally your job and my job is this one. Represent the civil, the society. So if you ask me, what does it mean to have daily support, operating support for the NGOs? For me, it's not to finance the bubble again and again, to give some more guests here in Brussels who can rent a flat from Belgian families or companies who can pay for beers and for restaurants here in Belgium. Our aim is to be at the front line and there next to the society. So if I will have chance to speak with the Commission or here in the Parliament, I will push them to finance those organizations who would like to use the networks. What I mean, there were several very interesting and important words, EU4Health, DG Sante, DG Employment, DG, I don't know which organizations, or the EU4Health budget, or any other words which are only here in the Brussels bubble. But when you ask one small NGO or civil organization in local level in Valencia or in Szeged, in my town, they will not understand anything about it. But the biggest problem, they will have never any kind of support from this bubble at the local level to organize anything. So, for example, when I organized one info session in Budapest for the NGOs, with the HDR, I invited the HDR. There were about 50 organizations, and I realized that for them it's totally new information, that we have European networks and European level of this kinds of work. So, of course, it's not a message to you. It's about us here in the European institutions, because and this is my last sentence, if we would like to keep the United European Union, and if we look around and we realize that how dangerous that movement, which will arrive, for example, from Hungary, it's a virus. The illiberal democratic movements, for them, the civil society is not important. So it's dangerous to have these kinds of independent voice. But they can be more and more strong if we can't make the real connections between the civil societies and the European level. So it's a big job, homework. We have to do it, and if I can help to do it, I will be here in the future too. So thank you so much, and enjoy your summer break, if you will have.